Hi, this is Leah, and this is how I'm showing that I met my goal, my final goal for sepsis. And it was just to know enough about sepsis from the reading, and then I added to it a few outside materials that involved mostly cell-mediating factors, and there was a few about fluid resuscitation and how necessary that was for septic shock. So that paired with the reading of the book, studying that, making some flashcards, really learning the septic shock process was my goal. And I wanted to know it well enough that I could teach back for a short little period about it and have enough information to do that. So sepsis is going to start with an infection. Most of the time, it's an infection from gram-negative bacteria. Now, there are aspects of this process that will happen without an infection present, like burns. The body will go into shock like this. So it's a similar pathway, but just not starting from infection. But I'm talking about infective sepsis. So starting from bacteremia. So it's mostly gram-negative bacteria. That's why it's really important to draw blood cultures prior to starting antibiotics, which is part of the Saving Sepsis campaign. So, and then it's going to lead to bacteremia. So it starts with inflammation markers. This is where the body was fighting the infection. Now the body's fighting itself along with the infection. So inflammation mediators that are involved with this process are going to be cytokines, epinephrine's released, interleukin, serotonin, and other cell stress markers. There's a lot of things that are actually released at this point. A lot of those T cell mediators and signaling cell markers are released at this point to draw other white blood cells in, T cells in, and platelets as well. A lot of platelets are drawn in at this point. So with the platelets being drawn in, they coagulate and they make a lot of tiny little microthrombi everywhere. And so it's harder to perfuse certain areas of the body. So you're going to start getting tissue hypoxia, which is why your patients are going to start looking dusky as the sepsis wears on. And then epinephrine is going to cause lactic acid buildup, which also is going to create tissue hypoxia. Then both of these are going to cause some vasodilation, where you're going to have a drop in blood pressure because of that, because your water hose that had a good structure to it and good form that created pressure to perfuse the body is now unable to do that, so your blood pressure is dropping. And then to compensate, your heart rate is going to increase. So that is sepsis. And going from sepsis to septic shock, the point that you know that is when you start with fluid resuscitation. Once fluid resuscitation is complete, and you aren't seeing an increase of blood pressure, a MAP above 65, and you're starting something like Levophed to keep the blood pressure up, you're probably going into septic shock, and that's that movement from sepsis to septic shock.